Hey everyone, it's Dr. Marcon, and we are continuing on with Chapter 4, Part 2 of Chapter 4 on tissues. So we started getting to loose connective tissue, and another type of loose connective tissue is adipose tissue. So adipose tissue is made up of closely packed adipocytes. Remember, specialized cells make up tissues, so we have adipocytes, or fat cells, that make up adipose tissue. We see that the nucleus is actually pushed to one side of the cell because within the cell there is a huge fat droplet. We know that adipose tissue is richly vascularized, so it has a really good blood supply. Functions of our adipose tissue include providing a reserve food fuel. It also helps us insulate against heat loss, and then supports and protects organs. We can see adipose tissue kind of providing a cushion surrounding certain organs, for example, around the kidneys. We can also find adipose tissue under the skin. We can find it behind the eyeballs, within the abdomen, some more than others, and in the breast, again, some more than others. And we can find our adipose tissue in the hypodermis, sort of that subcutaneous layer. To kind of make patients feel better, I tell them that, not that they're fat, but they just have a nice layer, a nice subcutaneous layer. But for the most part, we can find it underneath the skin, within the hypodermis. So here's just a generalized slide of adipose tissue. Again, it's a type of loose connective tissue. The matrix is the same as an areolar connective tissue, but very sparse. We have closely packed adipocytes, also known as fat cells, and we can see that the nuclei are pushed to the side, or pushed to the periphery by this large fat globule or droplet. Again, our adipose tissue provides reserve food fuel. In cases of starvation, our body will turn to our fat stores to provide us with energy when we don't have food as a ready source. Also insulates us against heat loss, and then supports and protects organs. We can find our adipose tissue under the skin, in the hypodermis, around organs such as the kidneys, around the eyeballs, within the abdomen, and in the breasts. We also have a type of adipose tissue called brown adipose tissue. This actually produces heat and occurs in babies to aid in thermoregulation. It has been found in adults, and we can see it between the two scapulae. So scapulae are our shoulder blades. We can find it on the sides of the anterior neck, as well as the anterior abdominal wall. This brown adipose tissue is actually very richly vascularized, meaning there's a lot of blood supply. We have cells that contain many lipid droplets and numerous mitochondria. The next type of loose connective tissue is reticular connective tissue. It contains a network of reticular fibers in loose ground substance. It forms a soft internal skeleton or stroma and does support other cell types. Again, we can find this reticular connective tissue in our lymph organs, such as lymph nodes, bone marrow, and the spleen. So spleen is actually a good model for where you can find reticular connective tissue. And in this next slide, we can actually see the picture that I showed you guys in lab of reticular connective tissue in the spleen. So we can see these kind of dark branches going through the tissue of the spleen. These are the reticular fibers. There might be some lymphocytes or white blood cells in the spleen. So again, reticular connective tissue is a network of reticular fibers in a typical loose ground substance. Reticular cells do lie on the network. Functions of the reticular connective tissue: it forms a soft internal skeleton or stroma that will support other cell types, including white blood cells, mast cells, and macrophages. Again, these cells are actually important for our immunity, our immune system. The location of the reticular connective tissue includes lymphoid organs such as lymph nodes, bone marrow, and spleen. So those were the three types of loose connective tissue. We now are getting into our dense connective tissue, again, part of the connective tissue proper. So we have three types of dense connective tissue. We have dense irregular connective tissue, dense regular connective tissue, and elastic connective tissue. We know that dense connective tissues are able to resist strong pulling forces and have more collagen than areolar connective tissue. First, we're going to talk about dense irregular connective tissue. Here we have collagen fibers that are thick but are irregularly arranged. Does contain some elastic fibers as well as fibroblasts. Again, fibroblasts being our primary cell type that produces the fiber types as well as the ground substance that make up the extracellular matrix. Functions of our dense irregular connective tissue includes withstanding tension and provides structural strength. We can find dense irregular connective tissue in the dermis of the skin, the submucosa of the digestive tract, as well as fibrous capsules of joints, capsules surrounding organs such as kidneys, bones, and lymph nodes. And here we see a slide of typical dense irregular connective tissue. We can see that the collagen fibers are kind of irregularly arranged, sort of like a swirling pattern, and then we can see nuclei of fibroblasts. So again, just a brief description. They are irregularly arranged collagen fibers. There are some elastic fibers. The major cell type again is the fibroblast. We have defense cells and fat cells that are also present in our dense irregular connective tissue. Now, important to note that dense irregular tissue is able to withstand tension exerted in many directions. Okay, this is one important difference between dense irregular and dense regular connective tissue, is that dense irregular can withstand tension in many directions. Also provides structural strength. We can find dense irregular connective tissue in fibrous capsules of organs and of joints. We can find it in the dermis of the skin, as well as the submucosa of the digestive tract. So here we see an example of dense irregular connective tissue from the dermis of the skin, which is that layer underneath the epidermis. And we'll see this again when we get into the slides showing the different layers of the skin. Next, we'll talk about dense regular connective tissue. We can see the collagen fibers are parallel to the direction of the pull. So we have these nice long parallel fibers that almost look like parallel waves. Fibroblasts are located between these collagen fibers, contain few elastic fibers, but has great tensile strength. Although they are poorly vascularized, we know that dense regular connective tissue helps form fascia. And if you ever get to dissect a cadaver, you will see fascia everywhere. Function of our dense regular connective tissue, it attaches muscle to bone, also attaches bone to bone, and withstands great stress in one direction, like the band. So unlike dense irregular connective tissue which withstands great stress in many directions, dense regular connective tissue withstands great stress in one direction only. We can find dense regular connective tissue in tendons and ligaments, as well as aponeuroses. Aponeuroses is a type of fascia that can connect two muscles. One example that I usually give is the aponeuroses in the skull that will connect the frontalis muscle located in the front part of the head and the occipitalis muscle, which is located in the back of the head. You have this fascia that connects the two muscles. Another location of dense regular connective tissue is fascia around muscles. So here we see those lovely parallel collagen fibers. Unlike the dense irregular connective tissue, which is sort of a haphazard kind of swirly pattern, we can see lovely waves of parallel collagen fibers, and we can see elongated nuclei of the fibroblasts. So the description of dense connective tissue, they are primarily parallel. There are a few elastic fibers, and of course the major cell type is the fibroblasts. Our Dense connective tissue will attach muscle to bones or muscle to muscles. It can also attach bones to bones. Again, withstands great tensile strength when pulling force is applied in one direction. We'll find dense regular connective tissue in tendons, most ligaments, and aponeuroses. So this example is dense regular connective tissue from a tendon. Our next type of dense connective tissue is elastic connective tissue. So just by the name alone, we can tell that the elastic fibers predominate in this type of connective tissue. A main function of our elastic connective tissue is allowing for recoil, especially after stretching. So we'll find this type of connective tissue in the walls of arteries, especially the great arteries such as the aorta. We can find it in certain ligaments and then surrounding bronchial tubes. It's important to find them in the arteries because it provides a pulsatile kind of nature, allowing for the movement of blood, especially when the heart is pumping blood away from the heart towards the body. We have the aorta and then other arteries that will allow for the pulsatile movement of blood to the rest of the body. Also in the bronchial tubes, when we inhale air, we want to be able to exhale the air, especially the carbon dioxide after we have diffusion of gases out from our lungs. So the elastic connective tissue gives the lungs that property of recoil to be able to exhale out carbon dioxide. So here we see a slide of elastic connective tissue in the wall of the aorta, and we can see these darkly stained fibers within the walls of the aorta. When we learn about blood vessels, you'll learn about the different layers within the blood vessels. So we have the innermost layer being the tunica intima, which is usually a very thin layer, and then we have this large muscular middle layer, which is the tunica media, and then we'll have an outer tunica externa or tunica adventitia. So just a description of elastic connective tissue. It's a dense regular connective tissue that contains a very high proportion or high amount of elastic fibers, allows recoil of tissue following stretching, maintains that pulsatile flow of blood through arteries, also allows for passive recoil of the lungs following inspiration to allow for expiration of carbon dioxide. Now we can find elastic dense connective tissue on the walls of large arteries, within certain ligaments associated with the vertebral column, and then within the walls of the bronchial tubes. The next type of tissue that we're going to talk about is cartilage. Now, all cartilages have similar structural components. We know that cartilage is firm. It's a flexible tissue. It does not contain any blood vessels or nerves. The matrix of cartilage contains up to 80% of water. We have the mature cell type, which is the chondrocyte. So again, if you see this prefix chondro, or this word part chondro, that means cartilage. So chondrocyte is the mature cell within the cartilage. However, we have chondroblasts. Whenever you see the word blast, think immature cells. Chondroblasts, these are the immature cartilage cells that will secrete matrix during cartilage growth. So we have three types of cartilage. We have hyaline cartilage, elastic cartilage, and fibrocartilage. Now each cartilage does have its own specialized function. First, we're going to talk about hyaline cartilage. Hyaline cartilage has an imperceptible amount of collagen fibers. Hyaline means glassy, so if you ever look at hyaline cartilage, it looks like ground glass. So we know that the chondroblasts produce the matrix, and we have mature cartilage cells called chondrocytes, which lie within lacuna. Lacuna are those spaces that we can see within the cartilage matrix. Function of hyaline cartilage includes support and reinforcement. It provides a very resilient cushion and also helps resist repetitive stress. We can find hyaline cartilage in the fetal skeleton. So When the fetus starts forming the skeleton, it first starts out as hyaline cartilage, and eventually this cartilage will ossify and turn into bone. We can also find hyaline cartilage at the ends of long bones, at the costal cartilage of the ribs. This is the cartilage that attaches the ribs to the sternum. We can also see hyaline cartilage in the nose, the trachea, and the larynx. So when we look at the trachea, you can actually appreciate not only the respiratory epithelium, which is a ciliated pseudostratified columnar epithelium, but we can also see the cartilaginous rings or C-rings within the trachea that are made up of hyaline cartilage. And again, we can also see hyaline cartilage in the larynx being our voice box. It helps us produce sound. So here is a slide showing hyaline cartilage. This is found in the costal cartilage of a rib. It has an amorphous but firm matrix. We know that collagen fibers form an imperceptible network. We have the immature cells, the chondroblasts, that produce the matrix, and when these cells mature, they become chondrocytes, and they lie in these spaces called lacunae, or lacuna. So lacuna matata, everyone. Here, the darker staining cells, you can see these are the chondrocytes, and then within the space is called the lacuna. Functions of our hyaline cartilage is support and reinforcement, serves as a nice resilient cushion, and resists compressive stress. Location of our hyaline cartilage, it forms most of the embryonic skeleton before it ossifies to become bone. It covers the ends of long bones in joint cavities, also forms costal cartilage of the ribs, as well as the cartilages of the nose, trachea, and larynx. Our second type of cartilage is elastic cartilage. Now, elastic cartilage is similar to hyaline cartilage. However, like its name implies, it has more elastic fibers in the matrix. Functions of elastic cartilage: it maintains shape of the structure but allows for great flexibility. A location of the elastic cartilage includes the external ear, also called the pinna, as well as the epiglottis. The epiglottis is a flap of cartilage that covers the opening to the larynx, which will eventually go down to the trachea, so that you don't have food going down to your trachea and down to your lungs. We all know what happens when we eat food and food goes down the wrong pipe. We start coughing and we have that irritable feeling in our chest. That's because, more than likely than not, you're probably eating and talking at the same time. So, long story short, don't talk with your mouth full. Unless, of course, have someone close by that knows how to do the Heimlich maneuver. So here's a nice slide showing you elastic cartilage. Again, we can see those lovely dark purple staining elastic fibers in the matrix of the cartilage, and we can see the chondrocyte in its lacuna. Definitely look for these darker staining fibers that are definitely indicative of elastic cartilage, okay? Not to be confused with elastic connective tissue. Elastic connective tissue we see in the walls of arteries and such. But here is cartilage. We can see the chondrocytes in the lacuna and the elastic fibers within the matrix of the cartilage. So again, it's similar to hyaline cartilage, but more elastic fibers. Function of elastic cartilage is to maintain the shape of a structure, but also allows great flexibility. If you've ever played with your ear and bent it several ways, it just bounces right back to its shape. So again, location supports the external ear called the pinna, and we can find it in the epiglottis. The third type of cartilage is fibrocartilage. The matrix is similar but less firm than hyaline cartilage, and we have thick collagen fibers that predominate. Function of fibrocartilage: it has tensile strength and ability to absorb compressive shock. Okay, so absorb compressive forces. And we'll find this type of cartilage in the intervertebral discs. So we have intervertebral discs of cartilage, fibrocartilage between the vertebrae to help with those compressive forces, especially if we're jumping around, if we're dancing. We can also find fibrocartilage in the pubic symphysis. It's that cartilage that joins the two hip bones together, the two pubic bones anteriorly. And then we'll also find fibrocartilage in the discs of knee joints, because we know our knees actually take up a lot of those compressive forces when we run around and jump and dance and such. So here we see a picture of the fibrocartilage. We can see these collagen fibers within the matrix, and we can see chondrocytes in lacuna. In other slides, we'll see rows of chondrocytes that kind of look like stacked coins or columns of stacked coins. That it's pretty indicative of the fibrocartilage. So matrix is similar to but less firm than that in hyaline cartilage. There are thick collagen fibers that do predominate. Function of the fibrocartilage is to have that tensile strength with the ability to absorb compressive shock. And again, we'll find fibrocartilage in the intervertebral discs, the pubic symphysis, and the discs of knee joints. And here we can actually see these intervertebral discs between the vertebra of the spine. So that's it for cartilage. We're now going to move on to bone tissue. So bone matrix contains inorganic calcium salts and an abundance of collagen fibers. We have our cells in the bone tissue. We have our osteoblasts. Again, blasts indicating an immature cell type. Osteo meaning of the bone. So we have our immature osteoblasts that will secrete collagen fibers as well as ground substance of the matrix. We then have our mature cells, the osteocytes, and we can see these mature bone cells in that space called the lacuna. Bone tissue is very well vascularized. It does need a good blood supply in order to keep it alive. Function of bone includes support and protection of organs, provides levers and attachment sites for muscles, also stores calcium and other minerals, also stores fats. And we have this substance in the middle of the bone tissue called bone marrow. And bone marrow is the site for hematopoiesis. Hematopoiesis means blood cell formation. So this is where we have the formation of our blood cells, our red blood cells, white blood cells. The location of bone tissue are bones, of course. And here we see osseous tissue of bone. So we can see a cross-sectional view of the bone. Description: it is hard calcified matrix containing many collagen fibers. We can see these dark, looking cells that look like ants or spiders with little lines coming from them. These are the osteocytes that lie in the lacuna. If you actually see this picture, it's you can see the osteocytes in the lacuna. And we know that this tissue is very well vascularized, meaning it has a good blood supply. Function of osseous tissue or bone tissue: supports and protects by enclosing, especially enclosing the organs within the abdomen and thorax, provides levers for the muscles to act on, stores calcium and other minerals and fat. We have bone marrow inside the bones. That is the site for blood cell formation, also known as hematopoiesis. So hematopoiesis is a very important term. You guys should know this term. This is the term meaning blood cell formation. Of course, we see osseous tissue or bone tissue in bones. The next type of tissue we'll talk about is blood tissue. So blood tissue is an atypical connective tissue, but it does develop from mesenchyme, and it consists of cells surrounded by a non-living matrix. So we have red and white blood cells in a fluid matrix. The function of blood tissue is to transport respiratory gases such as carbon dioxide and oxygen, transportation of nutrients, as well as the waste products of metabolism. We can find blood within blood vessels. So what is blood? Blood is the internal transport system for the organs of the cardiovascular system. Functions of blood include transport, regulation, and protection. So blood is a specialized connective tissue in which living blood cells are suspended in a non-living fluid matrix. The non-living fluid matrix that we're talking about is plasma. So components of blood consists of plasma and form elements. Again, that non-living fluid matrix that we're talking about is called plasma. It is a straw-colored sticky fluid made up of about 90% water and over 100 different dissolved solutes. Don't worry too much about this table. This is from another book. The formed elements are the living blood cells. Now, you'll also hear the term serum. Serum is basically just plasma without clotting proteins. Now here are the formed elements. We have our erythrocytes, also known as the red blood cells. We have our leukocytes, also known as our white blood cells, and there are two types of leukocytes. We have granulocytes and agranulocytes, and this is classified based on whether or not there are granules within the cytoplasm of these cells. So granulocytes obviously have granules in the cytoplasm. Agranulocytes, if you see the prefix A, that means without. So agranulocytes are cells, white blood cells that do not have granules within the cytoplasm. The next type of formed elements are platelets, and platelets are just basically cells that have broken off from a larger megakaryocytes, and platelets are very important, especially in clotting. Again, don't worry too much about this table, and you don't really need to know too much about normal values, but you do need to know which ones are more abundant than others, and we'll talk about that in just a little bit. The first types of cells we're going to talk about are erythrocytes. Erythrocytes are also known as red blood cells. Erythrocytes, they look like biconcave discs with no nucleus. So here, they kind of look like donuts. So it's kind of hollow in the middle of the cell, and it'll be hollowed out on the other side as well. So we have biconcave discs with no nucleus. Mature red blood cells have no nucleus. Immature red blood cells are called reticulocytes, and they will have a nucleus, but we don't want to see immature red blood cells because that means we don't have enough cells, mature red blood cells, to carry out the specific functions of these cells. So red blood cells, or erythrocytes, they carry oxygen to tissues and carbon dioxide to lungs. They have a protein called hemoglobin, which actually enhances the oxygen carrying capacity of these cells. Erythrocytes have a large surface area to volume ratio for rapid gas exchange, and the lifespan of erythrocytes is 120 days. And this is important clinically, especially for diabetics. We talk about a lab value called HbA1c. HbA1c is basically glycosylated hemoglobin, and like I said before, hemoglobin is a very important protein on red blood cells that allows for the oxygen carrying capacity of the cell. Now, glycosylated hemoglobin along with oxygen allows for erythrocytes also to carry a certain number of glucose molecules, or we get to kind of have an idea of the blood sugar content over the span of 120 days because we know these red blood cells live to be 120 days. So we measure HbA1c to kind of look at a diabetic patient's overall blood glucose control. If, they're telling their provider that, oh yeah, doc, hey, I'm totally taking my meds, I'm changing my lifestyle, I'm eating better, and I've got my, my fasting glucose under control, which can be true overnight if they fast for long enough and they're good for a day or two before the labs. However, if their HbA1c is elevated, we can see that their overall control of their blood sugar over the past 120 days has not been completely in sync with what they're telling their doctor. So if I have a patient that's telling me all these things, that they're doing everything they're supposed to do, but their HbA1c is highly elevated, I kind of have to tell them maybe you'd want to rethink what you're telling me right now. Let's examine exactly what it is you are doing, because your HbA1c is kind of telling me something different. So that's why HbA1c and the fact that your erythrocytes live to be 121 days is actually very important clinically, especially when we're working with diabetic patients. The next type of cell that we're going to talk about are leukocytes. So leukocytes are also known as your white blood cells. Our white blood cells will originate in the bone marrow and circulate in lymphoid tissues. They're very important in the defense against infections, and we have two specific types of white blood cells depending on whether or not there are granules present in the cytoplasm of these cells. We have granulocytes, and granulocytes are made up of neutrophils, eosinophils, and basophils, basically named based on how they stain. Our agranulocytes, meaning the cells that do not have granules in their cytoplasm, include lymphocytes and monocytes. Now, there's a really great mnemonic device that will help you remember the order of prevalence of these cells. So the most numerous are your neutrophils, and then you have your lymphocytes, your monocytes, eosinophils, and basophils. So the mnemonic I use is never let monkeys eat bananas. So you might see a quiz question asking you, okay, what is the least numerous of your white blood cells? And using this mnemonic, you can say, oh, bananas, basophils are the least numerous of the leukocytes. So this is definitely a very helpful mnemonic device to help you remember the order of prevalence of your white blood cells. So first we're going to talk about granulocytes. Granulocytes are spherical. They have distinctive multilobar nuclei, meaning they have many lobes to their nuclei. All of the granulocytes are phagocytic cells, so they can engulf any foreign invaders, just like a Pac-Man cell. They're identifiable by cytoplasmic granules, and specific granules can either bind neutral, basic, or acidic dyes. You have azurophilic granules that stain purple and are lysosomes. And we have three types of granulocytes. We have our neutrophils, our eosinophils, and our basophils. So here is an example of the neutrophils. So we can see that multi-lobed nucleus with the many lobes to their nucleus. So neutrophils are the most abundant of the white blood cells, make up about 60 to 65% total white blood cells, and the specific granules will stain a neutral color. These cells are also known as polymorphonuclear leukocytes. The nuclei are divided into 3 to 5 lobes. They provide defense against bacteria, fungi, cell debris, and foreign substances, and can survive about 4 to 5 days in tissues. They will travel and then marginate along the walls of blood vessels, and they can respond to certain signals that will signal that there's some sort of injury. So they will respond to chemotactic factors, and they are the first responders in inflammatory reactions. The next type of granulocyte are the eosinophils. Eosinophils make up about 1 to 3% of the total white blood cells. They have a bilobed nucleus, so there are 2 lobes to the nucleus. The specific granules will stain red with acidic dye eosin. So you can actually see, for me, eosinophils, you can see those red granules within the cytoplasm, and they're very distinctive. Unfortunately, you don't get to use a microscope this semester, but if you look at this cell, you can definitely see distinctive red granules. Now, eosinophils, when I think of these types of cells, I think of response to parasitic infections. So they respond to allergic reactions and parasitic infections, a type 1 IgE hypersensitivity. They will attack and kill parasites with the release of hydrolytic enzymes. The next type of granulocyte are your basophils. Basophils are the least numerous. They make up about 0.3 to 0.5% of total white blood cells. They also have a bilobed nucleus. However, you can't really see the bilobed nucleus because of the very dark granules that are stained within the cytoplasm. So they have specific granules that stain blue with basic dye. These granules contain heparin, histamine, and leukotrienes, which are important as mediators to an inflammatory response. So they participate in type 1 IgE hypersensitivity reactions. They are connected with mast cells that contain similar granules and can participate in the same response. Now, an increase in the amount of basophils can be a sign of CML, which is chronic myelogenous leukemia. So the way I like to describe basophils is they look like chocolate chip cookies. So for me, basophils are like chocolate chip cookie cells. So again, these types of cells are very rare, and I usually present a challenge to my students to try to find one of these chocolate chip cookie cells under a microscope, but it is a challenge to find. However, if you do find a lot of basophils, that could be indicative of an underlying pathology, possibly a type of leukemia. Next, we move on to agranulocytes. So agranulocytes, A means without. So these types of cells do not have granules in their cytoplasm. And there are two types of agranulocytes. We have our lymphocytes and our monocytes. And when monocytes travel to tissues, they become macrophages. So first we're going to talk about lymphocytes. Lymphocytes make up about 30% of the total white blood cells. They have a large dark nucleus and a very small rim of cytoplasm. I like to think of them as having a fried egg appearance. So we have this large nucleus that looks like the yolk of an egg, and then a very, very small rim of cytoplasm kind of on the periphery of the lymphocytes. So kind of looking like a big fried egg. So lymphocytes are important because they recognize antigens and participate in immune responses. And we have three types of lymphocytes. We have B lymphocytes, T lymphocytes, and our natural killer cells. Again, these cells very important in immunity and in our immune responses. And they're named based on where these cells mature. So for example, B lymphocytes will mature in the bone marrow, whereas the T lymphocytes will mature in the thymus. Next type of agranulocyte are our monocytes. Monocytes make up about 3 to 8% of total white blood cells. These are the largest of the white blood cells. They're pretty large. They're one of the largest cells, and they have a very distinctive dark kidney-shaped nucleus. So you have these large cells and these nuclei that look like kidney beans. So they have a large amount of cytoplasm and a dark kidney-shaped nucleus. So the azurophilic granules will contain lysosomal enzymes that are similar to neutrophils. Now, when these monocytes go to specific tissues, they will differentiate into a certain type of cell. So for example, when the monocytes go to loose connective tissue, they become histiocytes. When they go to the brain, they're called microglial cells. When they go to the liver, they are Kupffer cells. And when they go to tissue, they become macrophages. Okay, so they have that phagocytic property that helps kind of recognize antigen or recognize pathogens and clear off, those foreign substances. The next type of cell that we're going to talk about are platelets. Platelets are also known as thrombocytes. So thrombocytes, these are cells that are very important in clotting. Platelets are discoid cytoplasmic fragments of larger megakaryocytes that contain granules. They can stain a deep purple. They will seal small tears in blood vessels and are very instrumental in blood clotting. So if you see these little dark staining cells that are small in between red blood cells, these are platelets or thrombocytes. Again, very important to clot blood. So just some disorders of our different white blood cells and red blood cells. Erythrocyte disorders, we have a condition called anemia. This is when the blood's oxygen carrying capacity is too low to support normal metabolism. Causes of anemia include blood loss, a decrease in red blood cell production, or an increase in red blood cell destruction. Okay, this definitely messes with the blood's oxygen carrying capacity. So not enough tissue is getting to, or not enough oxygen is getting to tissues. On the other hand, if we have an abnormal increase or excess of erythrocytes, we have a condition called polycythemia. So polycythemia is an abnormal excess of erythrocytes that increases blood viscosity. So viscosity is basically the thickness of a fluid. If something is viscous, it's kind of like a thick, mucousy, not mucousy, but like a thick type of fluid. And if we have an increase in red blood cells, it will kind of cause the blood to kind of be sluggish, causing it to flow sluggishly. It's sort of like engine oil. So if we have clean engine oil, you know, the car will run pretty well. But if we start having gunk and stuff in the engine oil to make it thick and viscous, it kind of messes with the functioning of an engine. And that's probably the only car reference that I'll ever make, because I don't know very much about cars. Anywho, so we have polycythemia vera, again, is when we have an abnormal excess of erythrocytes. And we have what's called blood doping. So athletes, they want to increase their number of erythrocytes so they can increase the oxygen carrying capacity of the blood to their tissues, so their tissues can function at maximum level if we have an increased amount of oxygen getting to our tissues. So blood doping, if we have, you know, we test our athletes to see if they have an abnormal increase in the erythrocytes. We can see that they're using certain drugs to kind of enhance their performance. Leukocyte disorders, if we have an overproduction of abnormal leukocytes, we have our leukemias. We also have the kissing disease, infectious mononucleosis. Infectious mononucleosis is a disease spread by the Epstein-Barr virus. This is also known as mono. Mono affects younger people, especially those going to high school. And it's very contagious. It's known as the kissing disease. So guys, watch who you kiss. Another leukocyte disorder is leukopenia. This is on the other end, when you have an abnormally low white blood cell count. So penia means a decrease in the amount of cells, whereas if you have an increase in the amount of cells, it's usually called cytosis. So for example, leukocytosis is an increase in leukocytes, whereas leukopenia would be an abnormally low white blood cell count. Leukopenia is commonly induced by drugs such as glucocorticoids or anti-cancer drugs. Platelet disorders, we have a decrease in the amount of platelets, we can have our bleeding disorders. So a patient may present with abnormal ability to prevent normal clot formation, so patients will bleed out. Or if we have an increase in the amount of platelets, we'll have our thromboembolic disorders that result from conditions that cause undesirable clot formation. And that's usually bad because it can disrupt the flow of blood and occlude arteries or blood vessels that may result in an infarction or stroke, depending on where the clot is formed. So here we can see some of our examples of our blood cells. In this specific slide, we can see our multi-lobe nucleus of the neutrophil. We can see granules in the cytoplasm. It's a type of granulocyte. And here we can see that fried egg appearance of the lymphocytes. So the large nucleus in a very small room of cytoplasm surrounding it. And then we have our red blood cells. So here are the biconcave shaped red blood cells. And these, possibly these small little cells in between the red blood cells, these could be the platelets. So we can see red and white blood cells in a fluid matrix, a non-living fluid matrix, which is the plasma. Functions of our blood cells include transport of the respiratory gases, such as carbon dioxide and oxygen, nutrients and waste, and other substances. We know that these blood cells are contained within blood vessels. So this is a really good slide, a really good figure of the structure of tissues that will help provide clues to its location and function. So this first table shows you epithelial tissues. Again, the way we name our epithelial tissue, first we look at the number of layers. If we know that there's a single layer, we call them a simple epithelium. If they're more than 2 or more, we call it stratified. And then we looked at pseudostratified. It was still one layer, but because of the level of the nuclei within the cells, and some cells don't even reach the apical surface, they look somewhat stratified, but really it's just one layer of cells, so we called it pseudostratified. And then we look at the different shape of the cells at the apical surface. We talked about squamous shapes, which are flat disc or flat plate-like shapes. We looked at cuboidal cells that look like cubes, and then we have these tall columnar type cells. And again, we look at first the number within that layer. If it's one layer, it's simple. If it's many layers, it's stratified. And then we can look at the cells at the topmost or apical layer. So if it's one layer of squamous cells, we call it a simple squamous epithelium. If it's many layers of squamous cells, or if there are many layers with the squamous cells at the very apical layer, we call it a stratified squamous epithelium, and so forth with the rest of the other types of epithelium. The next slide just showing you the connective tissue. So first we look at the common characteristics of connective tissue. As opposed to epithelial tissue, there's only a small amount of cells. But we know that connective tissue has extracellular matrix, which is made up of ground substance and protein fibers. But then we, look at where the cells are located within the matrix. We look at cells that are in direct contact with matrix components that makes up your connective tissue proper, which then can be further divided into loose connective tissue and dense connective tissue and the different types within. And then we have bone and cartilage. So bone and cartilage, the cells are in spaces called lacunae. Those open kind of hollow spaces. And then we looked at the different types of cartilage. We had our hyaline cartilage, elastic cartilage, and fibrocartilage. And then we have blood. We know that the blood cells are suspended in a non-living fluid matrix called plasma. And then we looked at the different types of cells that make up the formed elements of blood. So within the body, we have covering and lining membranes that combine epithelial tissues and connective tissues. These linings cover broad areas within the body and consist of epithelial sheets plus underlying connective tissue. So we have 3 types of membranes. We have cutaneous membrane, which is our skin, and then we have mucous membranes that line the hollow organs that open to the surface of the body. The composition of, or what mucous membranes are made up of, are an epithelial sheet that basically overlie a layer of lamina propria. And we know that connective tissue makes up the lamina propria. The next type of membrane is a serous membrane. A serous membrane is made up of a simple squamous epithelium called mesothelium, lying on areolar connective tissue. Serous membranes line closed cavities such as the pleural cavity, the peritoneal cavity, and the pericardial cavity. This epithelium and this membrane produce serous fluid that goes within the cavity. So here we see a picture of the cutaneous membrane over our skin that covers the body surface. Here we have mucous membranes that line the body cavities that are open to the exterior. So we have mucosa of the nasal cavity of the mouth, mucosa of the esophageal lining, mucosa of the lung bronchi. And then we have our serous membranes that line the body cavities that are closed to the exterior. So we have our parietal pleura, and visceral pleura, so these serous membranes surround the lungs. We have our pericardium, we have the parietal pericardium and the visceral pericardium. Again, visceral means organs, so this visceral layer is the layer that is closely attached to the heart, just like the visceral pleura is the serous membrane layer that is closely attached to the lung. And then we have the peritoneum. The peritoneum are the serous membranes that line the abdominal organs within the abdomen. We have the parietal peritoneum, which lines the outer cavity wall. And then we have the visceral peritoneum. So this layer is closely adhered to the visceral abdominal organs. Next, we're going to talk about muscle tissue. So muscle tissue is a composite tissue that contains areolar connective tissue in addition to muscle tissue. Now, most muscle cells are called muscle fibers. These cells contain myofilaments, and the myofilaments contain actin and myosin, and these myofilaments are very important for contraction and movement of muscle. So we have three types of muscle tissue. We have skeletal muscle tissue, cardiac muscle tissue, and smooth muscle tissue. And first we're going to talk about skeletal muscle tissue. These are made up of long cylindrical cells. They are multinucleate, meaning they contain many nuclei, and we have obvious striations. Function of skeletal muscle tissue, of course, is voluntary movement, as well as manipulation of the environment, and we have our muscles of facial expression. Skeletal muscles are attached to bones, and occasionally they can be attached to skin. Here we see a slide of typical skeletal muscle. We can see the long cylindrical parallel muscle fibers. We can see multinucleate cells, so many nuclei. And then, of course, our obvious striations within the skeletal muscle fiber. Function of the skeletal muscle: voluntary movement, locomotion, manipulation of the environment, as well as we have our muscles of facial expression. We can find skeletal muscle attached to bones or sometimes attached to skin. So we have different bands that represent either thick or thin bands within the sarcomere, which we talked about in lab. So dark bands, the darker bands, if we see one up close, those are representative of the A bands, whereas the light bands, there's an I in light, so the light bands represent the I bands within the sarcomere. Next, we talk about cardiac muscle tissue. Unlike skeletal muscle tissue, the cardiac muscle cells are branching. However, they are striated, just like skeletal muscle tissue. And generally, they only have one nucleus, so they are uninucleates. And then we have interdigitation of these cells at structures called the intercalated discs. So we have these dark bands where cells will kind of connect to one another. Function of the cardiac muscle tissue is to propel blood by contraction of the muscle tissue to propel blood into the circulatory system. We can find cardiac muscle tissue, of course, only in the walls of the heart. So here we see a slide of typical cardiac muscle. We can see that the cardiac muscle cells are branching. They're not parallel like the skeletal muscle. We see these intercalated discs, these dark bands where cardiac muscle cells will kind of interdigitate with one another. And then we know that the function of cardiac muscle cells is that as it contracts, it will propel blood into the circulation. And we know that cardiac muscle is under involuntary control. And we see examples of cardiac muscle only in the walls of the heart. Smooth muscle tissue, we have spindle-shaped cells with a central nuclei. They are arranged very closely to form sheets, and they do not have any striations. Function of smooth muscle tissue is to propel substances along internal passageways, and they are under involuntary control, and they line mostly the walls of hollow organs. So here we can see a slide of smooth muscle tissue. We can see the nuclei of the smooth muscle cells. So these are spindle-shaped cells with the central nuclei. There are no striations within the smooth muscle, and the cells are arranged closely to form sheets. Function of the smooth muscle is to propel substances or objects, such as foodstuffs, urine, even a baby, along the internal passageways, and we know that smooth muscle is under involuntary control. Location of the smooth muscle is mostly in the walls of our hollow organs. So now we're going to move on to nervous tissue. Nervous tissue are the main components of the brain, spinal cord, and nerves. Nervous tissue contains two types of cells. We have the main cells of the nervous system, which are the neurons. Neurons are important because they generate and conduct nerve impulses. And then we have the supporting cells called the neuroglia. Neuroglia nourish, insulate, and protect neurons. Functions of our nervous tissue is to transmit electrical signals from sensory receptors to effectors. Effectors can be either muscles or glands, and these effectors carry out the signals from the nervous tissue. Location of the nervous tissue include the brain, the spinal cord, and nerves. So here we see a really lovely picture of nervous tissue. The cells of the nervous tissue are the neurons. So we can see these darkly stained neurons, the cell bodies of the neurons, as well as the different neural processes. And then surrounding the neurons are the supporting cells known as the neuroglia. So if we look at the anatomy of the neuron, we know that the neuron will have a cell body, and then it will have little branches coming off the cell body called the dendrites. Dendrites actually receive messages from other neurons. And then neurons usually have one long axon where they can generate impulses and then move that impulse along the axon so that it can be transmitted to another neuron. Functions of our nervous tissue is to transmit electrical signals from sensory receptors and to effectors such as muscles and glands that will control the activity of the effector organs. Location of our nervous tissue, we can find it in the brain, spinal cord, and nerves. Now, how does tissue respond to injury? We have an inflammatory response. An inflammatory response is nonspecific, it's a localized response, and it helps limit the damage to the injury sites. Now, the immune response takes longer to develop and is very specific. It will destroy particular microorganisms at the site of infection. So inflammation, we have acute inflammation. Acute means it doesn't take a very long time to develop, unlike chronic inflammation. So acute inflammation includes symptoms of heat, redness, swelling, pain, and then chemical signals are sent to nearby blood vessels to help them dilate and bring more blood to the area. Histamine. Histamine will increase the permeability of capillaries so that more cells can go to the area of damage. Edema is actually a symptom of inflammation. Edema occurs when we have an accumulation of fluids. Remember, we said that histamine kind of increases the permeability of the capillaries so that more fluid and more cells can come to that area. Then we'll have edema, which is an accumulation of fluid in that area. Edema will help dilute the toxins secreted by the bacteria, also will bring oxygen and nutrients from blood. It brings antibodies from blood to also help fight infection. So how does the body repair itself? We have regeneration. Regeneration is a replacement of destroyed tissue with the same type of tissue. We also have fibrosis. Fibrosis is the proliferation of scar tissue. And then we have organization. With organization, a clot will be replaced by granulation tissue. So here we can see how tissue repair occurs in a skin wound. So first we have the inflammation that sets the stage. We know that once we have a cut, the severed blood vessels will bleed, inflammatory chemicals will be released, Then the local blood vessels will become more permeable, meaning more things can kind of filter through, which allow white blood cells, fluid, clotting proteins, and other plasma proteins to help seep into the injured area. Then we have clotting that occurs thanks to clotting factors in the blood, and the surface will dry and form a scab. Next, we have organization that restores the blood supply to the area. The clot will be replaced by granulation tissues, which restores the vascular supply of the area. Fibroblasts will produce collagen fibers that will help bridge that gap. We have cells such as macrophages, which will phagocytize any dead and dying cells and other debris to kind of clear out that area. And then we have surface epithelial cells that will multiply and migrate over the granulation tissue. Next, we have regeneration and fibrosis, which affect permanent repairs. So the fibrosed area will mature and contract, and we have thickening of the epithelium. A fully regenerated epithelium with an underlying area of scar tissue will result. So throughout life, at the beginning of the second month of fetal development, primary tissue types have already appeared, and major organs are in place. Now, in adulthood, only a few tissues can regenerate, and many tissues still retain populations of stem cells. So basically, this is a picture of the embryonic germ layers and the primary tissue types they produce. Okay, so we have in blue ectoderm. Ectoderm, we can see ectoderm participates in epithelium. Actually, all three germ layers come and produce epithelium. So we have ectoderm, mesoderm, and endoderm, which will produce the different types of epithelium. We can see that ectoderm produces nervous tissue. Mesoderm not only participates in production of epithelium, but also muscle and connective tissue. And then endoderm, so this layer right here, forms the inner lining of the digestive and respiratory organs. Now, tissue capacity for regeneration. These types of tissues regenerate either good to excellent, so that's epithelial tissue, bone connective tissue, areolar connective tissue, dense irregular connective tissue, and blood-forming connective tissue. Moderate capacity for regeneration, we have smooth muscle tissue and dense regular connective tissue. A weak capacity for regeneration, that's skeletal muscle tissue and cartilage, and then none or almost none capacity for regeneration, we have cardiac muscle tissue and nervous tissue. So once we damage this type of tissue, there's hardly any regeneration of this type of tissue. With increasing age, we know that we have a thinning of the epithelia. The amount of collagen that is produced decreases. Bones, muscles, and nervous tissue will begin to atrophy. And then because as we get older, older patients tend to have poor nutrition and poor circulation, which then will lead to poor health of tissues. So we know that all of this occurs when we get older. So it's best that, now while you guys are young, you need to take care of your skin, take care of your connective tissue, make sure you're well hydrated, make sure you're not bringing any toxins or anything bad into your body that might damage your tissues, because once we get older, a lot of things tend to we don't have enough production of these important proteins and fibers and things that make up our connective tissue, and that means we tend to slow down, and eventually our body just can't handle the lack of regeneration and the lack of appropriate tissues. So take care of your bodies now, eat right, get lots of sleep, and make sure you're staying well hydrated. Okay, so that is chapter 4 on tissues.